Hi, my name is Samantha Kogo, and my video presentation is on gender reassignment and whether minors should be permitted to have gender reassignment surgery. Gender dysphoria is defined as the feeling of discomfort or distress that might occur in people whose gender identity differs from their sex assigned at birth or sex-related physical characteristics. People who experience gender dysphoria is more commonly known as transgender. They may feel disconnected with the gender that their biological gender. A man may feel like a woman may feel like a man, something along this line. The statistics for the United States, I couldn't really find much on other countries, but there's an estimated 0.7% of adults aged 18 to 24, 0.6% of adults aged 25 to 64, and 0.5% of adults aged 65 or older who identified as transgender or perhaps were diagnosed with gender dysphoria. Most people who identify as transgender stated that they felt this way before the age of 7. 73% of transgender women and 78% of transgender men say that they knew that this was how they were by the age of 7. Nationally, there's an estimated 0.39% of people, or 390 per 10,000, and almost 1 million people nationally who identify as transgender. This is not something that the census can count because there is no way to really word this without legal matters being involved. People who identify as transgender or who have been diagnosed with gender dysphoria feel that they need to hide this from other people. They think that they are different and people will not accept them. People from older generations may refuse to acknowledge that they are transgender or that they have gender dysphoria because they were not raised to believe that these things were acceptable. Their parents may have been from a generation that mocked people like this, and people that do accept and acknowledge their transgenderism or gender dysphoria, they may choose to stop their transition after they have had some accomplishments with hormone treatments. They may feel that taking these hormones of the opposite gender, the gender that they identify as, the hormone treatments may help them reach the results that they were originally looking for. They may feel discomfort and disconnect from their biological sex. And children are oftentimes confused by this. They don't understand why they feel like they are the other gender than what they were born as. They may not understand why they prefer to play with boys' toys if they were a little girl, or the opposite. They may not understand why they are a little boy that wants to wear dresses, but this feels normal to them, so they beg their parents for toys from the gender that they identify as. And all of these feelings should be validated. No child should feel like there is any reason that the people in their lives do not love and accept them. Even if the parent or guardian, does not understand what their child is feeling, they should not mock them or make them feel like they do not belong. Characteristics in children with gender dysphoria, they may insist that they are their preferred gender. A little boy may insist that they are a little girl despite what their birth certificate states. They may prefer to dress in the clothing. They may prefer the toys little boys may prefer dolls and little girls may prefer Hot Wheel toys. They often prefer the stereotypical activities of the preferred gender. They may want to play football or do ballet, and they have a preference for playmates of their preferred gender. Little boys who identify as little girls prefer to play with other little girls, and vice versa. They also may experience a strong dislike of their genitals. They may hate what they have because that is not how they feel. That they think they have the wrong genitals. To have surgery for gender dysphoria, to have a gender reassignment, there has to be a clinical diagnosis of gender dysphoria. Following this, there needs to be at least 12 months of hormone treatments with 2 letters of recommendation from a psychiatrist and a gender specialist before insurance will consider this as a medically necessary surgery. Once it is, there may be different stages, but most insurances will not cover a detransition. They deem the original transition as medically necessary, but a detransition is not. There are obviously risks that come from any type of surgery, and gender reassignment is no different. They can include infection. The surgical sites can obviously get infected. Infertility can come from gender reassignment surgery. Obviously, there can be death. Any type of procedure can result in death. Post-operation, the individual may feel depression. They may regret their choice. They may feel like they've made the wrong decision and think that they did not think it through enough and regret altering their bodies. And people without any type of support system or without a strong support system can contemplate suicide and may actually follow through with it. The support system needs to be strong. With this being such a controversial issue, there is a big risk of rejection from the family, and this is why many people hide their feelings of transgenderism and gender dysphoria, because they feel that they will not be accepted, and some people believe that the fear of rejection, the rejection from their family and their loved ones, it's scarier than not being true to yourself. With the support system, that it needs to be in place for the physical healing, for the psychological adjustment, and for any type of post-op assistance. Just like with any type of surgery, there is going to be pain, and everybody feels better if there is somebody that can help, even if it's something as simple as grabbing your pain medicine or helping you walk to the bathroom or getting you an ice pack. Mentally, you need somebody that you can talk to without judgment, somebody that will not judge your choices and will love you unconditionally. The causes of gender dysphoria are still unknown, but with many things that are considered mental issues, there's possibilities of hormone fluctuations while the fetus is still in the womb. Genetics could play a part. There could be cultural and environmental factors that can lead to gender dysphoria. Research in the United States is very difficult for fetus, infants, minors in general, because they are so well protected by things like this that the hoops to jump through to be able to study a child that has been diagnosed with gender dysphoria and have it recorded for research such as this is very difficult. Though there are not very many reasons that are deemed medically necessary to have this type of surgery. The reasons to deny are very specific. You should not deny a child from feeling the way they do just because you do not agree with it. It doesn't make sense to you. That's not a good enough reason to make a child feel unloved or unwanted. But the child should also not be allowed to have such a significant surgery just because this is how they feel. They, just like anybody else, they should wait until they are older and have done research and are absolutely positive that this is how they want to continue with their life. The child, your brain is not, research says that your brain is not fully developed until around age 25, which means that a 12-year-old is not mature enough to make this kind of decision. Even though that is how they feel, and they may feel this way when they reach 18 and can make the decision for themselves, they are not mature enough when they are preteens to make this decision for themselves. And teenagers are not known for making the best decisions. You should not cave and allow a child to get the surgery because they threaten to commit suicide. The criteria must be met. There needs to be the diagnosis of gender dysphoria, the hormone treatments, the letters from the psychiatrist, and the specialist. This all needs to be met before the child is allowed to be considered for the surgery. And even then, they should not be. Most surgeons will not do the surgery before they are 18, regardless. And here are the steps to meet the criteria. You have to have the diagnosis, and then you're assigned the hormone treatments, which are closely monitored by specialists. Then you have to have the 2 letters of recommendations, one from a psychiatrist and one from a gender specialist. You need to have the proof of the hormone treatments that you have been following religiously for 12 months, and then surgery may possibly be considered. Insurance, as I touched on earlier, they'll cover the initial transition under the cause of mental. It's considered a mental diagnosis. It is Aetna breaks it into different categories. They cover the initial transition but not the detransition, and they break it into breast removal, breast augmentation, gonadectomy, which is where they alter they'll do like a hysterectomy, and then the genital reconstructive surgery, which is where they create the genitals of the desired gender. There are issues, and obviously these are for adults that have transitioned. You can face divorce. Your spouse may not agree with what you have done and choose not to stay with you. There can be custody battles. Since this is considered a mental illness, the opposite party can argue that you are not mentally stable enough for a child to be left in the home. Though job loss is less frequent in states where you do not need a reason to fire somebody, this could be an issue. West Virginia, for example, is a fire at will state. If they decided that they didn't agree with what you were doing, they could possibly wait until enough time has passed and then dismiss you from your position. And they wouldn't have to provide any proof for their reasoning because it's an at-will state. Your family could reject you. A lot of people have issues with transitions because they fear this. And then, of course, suicide, which is a big issue because a lot of people feel that they are unloved and they are not accepted, and this leads to suicide. A lot of people do not have the appropriate coping mechanisms for something like this, and the lack of a strong support system can increase the chances of suicides. Most of the medically necessary reasons for gender reassignment surgery are psychological, and it can be difficult to ascertain the actual reasons because something like this can be considered mostly cosmetic, and most insurances will not cover a cosmetic surgery unless there has been like a prior injury. For example, like a burn where they do a skin graft. Children and minors may try to play the system and threaten suicide if they do not get their way. Again, this is something that should not be allowed. As I said earlier, teenagers are they're not known for making good decisions, and they may have something like this done earlier in life. They may end up regretting it and change their minds later on. And with this being such an expensive surgery, it is something that should be considered very carefully. The percentage of people that regret their gender reassignment is not significant, but it is still important. It's something that should still be considered. A study in 2015 stated that 11% of women, 4% of men, and 8% of an unmentioned gender they detransitioned after their initial transition. They regretted their decisions and decided to go back to their biological gender. The hormone treatments, even though it is the first step, it does have its risks too. Men taking female hormones doubled the stroke risk of both men and women, doubled their heart attack risk, and increased their blood clot risk by 4.5 times the original. And women taking male hormones tripled their heart attack risks. So there's significant risks to hormone treatments. But this can also be the step that most people need to feel complete. They may be happy with the way the hormone treatments alter their bodies, which can be hair growth or loss, breast enlargement, and voice pitch. It can cause irreversible infertility in some people. Stopping the natural hormones and altering them can modify the body to make it so that the person is infertile. Though some cases it can be reversed, not every case can. Additionally, there are issues post-op where there is fertility issues. Obviously, your body's not going to be producing the same things that it would naturally. There is a part of the surgery where a prosthesis is inserted into the newly created penis where it helps it become erect. It helps with the erectile functions. The surgery was actually first used to treat erectile dysfunction. It can also, having the penile reconstruction can also cause urinary issues because, again, it's not the way nature made it. It's man-made, so there's always the possibility of issues. Each individual, they need to have their feelings validated. It does not matter what age they are. Everybody needs to feel that there's somebody that loves and cares about them. It is a very confusing and stressful experience, and it helps to have somebody that, even if they don't understand, they care enough that they are willing to listen and try to understand. Not everybody needs somebody that will make things better. They just need somebody that will listen. People need to know that they are not alone. And in conclusion, as I stated, this is classified as a mental disorder, and that's how insurance can cover it. It affects approximately 0.39% of the United States population, and people can still feel disconnected after their surgery. They may still feel like something is not right. The brain has not finished development until approximately the age of 25, which is why minors should not be allowed to make this decision, and the only reason that this should be done on a minor is if a doctor deems that it is medically necessary. And here are my references, and I appreciate your time.